Good morning, everyone, and thank you for joining us today. Apologies for the delay. We just had a technical issue we were sorting out. In the Legislative Building in Regina, we have Minister of Health, Paul Merriman, and Chief Medical Health Officer, Dr. Saqib Shahab. Joining us over the conference line is SHA CEO Scott Livingstone and SHA Chief Medical Officer, Dr. Susan Shaw. I believe both the Minister and Dr. Shahab will have opening remarks, followed by time for questions.
Good morning and thank you for joining us. Over the past few weeks, we have seen a significant increase in the numbers of new and active COVID-19 cases in Saskatchewan. Our case numbers are still quite a bit lower than our neighboring provinces, but make no mistake, our case numbers, our hospitalization numbers, the numbers of the patients in ICU, all of these have been heading in the wrong direction. We need to work now to ensure they don't climb even higher to the levels that we've seen next door. That's why today we are announcing some new restrictions. Restrictions around liquor sales in bars, restaurants, fitness classes, in gyms. An expansion of mandatory masking to more Saskatchewan communities. All restaurants, bars, and licensed establishments will need to stop serving alcohol by 10 p.m., as well as hookah and waterpipe services are no longer allowed. It is our sincere hope that a reduction of hours in alcohol service will prevent us from needing to proceed with more significant closures in this sector. All group aerobic activities in gyms and fitness facilities must now have at least 3 meters of space between them. If this cannot be followed, those classes must be suspended. Also, we are opening up all school divisions to consider moving to level 3 in their back-to-school plans. This is specific to high schools with 600 students or more. Mandatory masking in indoor public spaces are currently required in Saskatoon, Regina, and Prince Albert. Now this will be expanded to all communities of more than 5,000 people. The new masking requirements will cover more than 65% of Saskatchewan's population. And of course, these are also the major trading centers within our province. Thousands of Saskatchewan residents from surrounding communities visit these centers every day to shop and access other services. All of these measures come into effect on Monday to give everybody time to get ready. That said, if you're able to start before that, we would strongly encourage you to do so. All of these measures are in place until December 4th and be reviewed at that time. Dr. Shahab will speak more about these measures in just a moment. But beyond the specific restrictions we are announcing today, I want to say this. We all need to take the threat of COVID-19 seriously, like we did back in the spring. We need to make sure we get back to basics, back to the good practices that allowed us to be successful controlling the spread of COVID-19 throughout most of the spring and summer. We all need to be more careful about physical distancing, washing our hands more often, limiting our number of close contacts, limiting travel, avoiding large groups, wearing a mask in indoor public places. No one wants to get back to another lockdown. No one wants to close businesses and put people out of work. But we need to slow down the spread of this virus. A slowdown is how we will avoid another lockdown. I'm not going to sugarcoat the situation. It's not great, and it's getting worse. This threat is very real. But I believe we can get it under control if we do the right things. Saskatchewan, you've done this before, and I know that you can do it again. Dr. Shahab.
Thank you, Minister. So I'll just go over a few things in a bit more detail. So as the Minister said, we are taking our recent increase in case numbers, especially over the last 2 weeks very seriously. And it's important that we continue to look at cases averaged over a week because, for example, this week we have had a high of 190, but possibly a low, which may be announced later today, of 81 cases a day. So there's fluctuations based on testing volumes and batching, and testing volumes changing on a day-by-day basis. But even if you look at our average over a week, we are at 123 cases per day. And like I said in the past, 5 cases per 100,000, which is around 60 cases per day, is when we need to sit up and start taking notice. 10 cases per 100,000, which is around 120 cases a day on average, is when we need to start looking at specific measures to slow our transmission down, and we are at that rate now. And secondly, our test positivity rate, which is another metric that we follow closely, is at 6%. So again, test positivity rate 3% and higher, sit up and take notice. Anything that goes above 5%, we need to then look at that very closely and make sure that we keep our test positive rate as low as possible, well under 10% overall, but we want to see that trending down over time. And also, I think we all have to remember why we all need to take precautions. We have, over the last few days, lost 4 more Saskatchewan residents to COVID-19, and our condolences and sympathies with the family and care providers. But again, this is why we all need to take precautions to protect ourselves, our families, our communities, and those who are more vulnerable. Now, while these cases are a result of activities that happened 10 days ago, it means that we need to take measures today to prevent cases into the future. So all the measures we take today will reflect in the case numbers we will have next week and the week after that. And we've also seen, when we've looked at outbreaks, we've seen outbreaks now. Thankfully, we haven't seen those super spreader events, and that's great because people are very cautious now in not having gatherings more than 15 or 10 in the house now. Receptions no more than 30, but as small as possible, following the guidelines. Places of worship, other places, up to 150. But this is the time to attend virtually where possible, just like in March. This is the time to make sure that we're physically distant, wearing a mask, and minimizing rituals where there's multi-touch opportunities for transmission. But when we look at transmission now, it's in every activity, even where guidelines are being followed. We have seen cases in recreational sports, in gyms, in bars, worship services. And what that means is we need to look at all those guidelines on a weekly basis and either adjust the guidelines, as we have for now bars and restaurants, where there's no service after 10 for alcohol, but food can be served. But we all need to also practice those guidelines, both as customers and not just business owners. Go and sit at a table of 6, wear a mask when you're going in. When you're going to the washroom or leaving, wear your mask again. That's how we limit transmission in those settings. And unfortunately, if we can't limit transmission in those settings and our case numbers go up, then we have to look at further restrictive measures. So as of today, what we will be updating as of information just now that we received, we have 53 individuals in hospital and 15 in ICU. So again, we can see our hospitalizations are trending up. Our case numbers started rising significantly about 2 to 3 weeks ago, and now our hospitalizations are trending up. So there's always a 2 to 3 week lag. But this is again showing that even though the bulk of our cases are in young adults who, for the most part, have mild illness, there is then overflow into people who are older, people who have underlying risk factors, and that is then reflected in hospitalizations and deaths that we are now seeing. And that is exactly why now, and Mr. Livingstone and Dr. Shaw will speak to that, how that then starts putting pressure on the acute care system. We are also seeing pressures on contact tracing. So there were times over the last 2 weeks where it was very challenging for public health with increasing cases to follow all the contacts. On average, we have 5 to 8 contacts per person, but some of us have dozens of contacts. And again, we all need to look at what are we doing on a day-by-day basis, what's essential, what's discretionary that we can slow down. Do we really have to go to that gathering of even less than 10? Do we have to go to that reception? Do we need to hold that reception now? We need to look at all our activities and slow them down. In March, I used to say when you're going grocery shopping, try to go one person from a household if possible, make a list, go and pick what you want and come back. We need to go back to that. reduce the traffic in retail. Christmas shopping is great, shop local, but go when it's less busy, be very deliberative about what you want to get, and come back. So I think all those actions, when we all do that in a safe manner, wearing a mask, keeping a physical distance, that has an impact in the numbers we will see in the future. And then the final comment I'll just make is that we had some interest in modeling, and so modeling is a very important tool. And I have to recognize that in the University of Saskatchewan, we have some of the most accomplished modelers internationally who are a resource for Saskatchewan, Canada, and internationally. So modeling is a tool that we in government and in public health use along with epidemiology to try to predict that based on what we have seen. So initially in March, the modeling predicted what we could see based on what is happening in Wuhan. Then in April, the modeling predicted what we could see based on what is happening in Italy and then New York City. And then over the summer, the modeling predicted what we could expect to see based on what is happening in Canada. We weren't seeing that many cases, but other parts of Canada were and the US were, that what we could see in similar health systems in Canada. And then the modeling predicted how easy it was to bend the curve. And by easy, I don't mean the sacrifices we all have to make. We all have to stay home if we're sick, maintain physical distancing, wear a mask, limit our social activities. But if we all do that, the curve bends. And you don't need to have big lockdowns. You don't have to have even slowdowns in the economic sector. But we can only avoid that if we all do these things. Not if some of us do it, but if all of us do it. So again, anecdotally, we can see that maybe there's people are just closer together when shopping. Maybe everyone isn't wearing a mask, and we just need to revisit that. Because when all of us do these simple measures, the curve bends. That's what the modeling has been predicting. But the modeling is also predicting that if we are unable to do that, our numbers will trend up, and many other jurisdictions have reached the same conclusion. And if there's interest, I can bring some presentations on an epidemiological update as well as a modeling update next week. Thank you.
Thank you, Minister. Thank you, Doctor. We also have opening comments on the phone lines from both Scott Livingstone and Dr. Shaw. We'll go to Scott Livingstone, CEO of the Saskatchewan Health Authority first.
Thanks, Jim. So, as everyone knows, yesterday the Saskatchewan Health Authority announced the reactivation of our Emergency Operations Center. The EOC will be fully operational early next week. The re-establishment of the EOC is a result of the significant increases in cases and hospitalizations that we've seen over the last week. We expect that we are going to see continued high case numbers, and we've determined that it was necessary to reactivate the EOC to strengthen our coordination across the organization and send a signal that we are going to have to mobilize resources across our teams. As Dr. Shahab said, the cases we see today are from 2 weeks ago, and as we looked at our case positivity rate over this last week, we are going to see an uptick in hospitalization and ICU admissions over the next couple of weeks, and we are preparing. So to respond to these pressures that we have been seeing, the Saskatchewan Health Authority has already added over 550 positions in key priority areas to support their COVID response. We also continue to identify a number of areas of need and recruit and hire key personnel. But I want to be clear that this will not be enough. Addressing our pressures solely through the labor market will not be possible. It is also going to require us to redeploy staff internally. As the minister has also outlined, early in spring of this year in 2020, we were able to redeploy staff fairly easily because of the very broad across-the-board service slowdowns in the health sector. Those actions were taken out of an abundance of caution to respond to a virus that at that time we didn't know very much about. At this point in time, we are not planning any across-the-board service slowdowns going forward, as we believe the impact on the health of people that we serve is too great. We will, however, be looking at targeted, localized, and time-limited service slowdowns. We were going to do this where it absolutely needed to support the redeployment of staff to combat the virus as well as maintain essential services. It's critical to remember that our commitment will be to make these as minimal as possible in both their scale and their duration, but they will be needed at times over the next few months and weeks to fight COVID and ensure that our acute care services remain available to those who need them, both COVID and non-COVID patients. I also want to comment on the impact that the virus is having on our system and underline some of the help we need from the public. Recent large increases are putting an immense pressure on our major hospitals, especially in Saskatoon. Saskatoon, as you know, the ICU capacity challenges, along with increased COVID admissions, have prompted our ICU team to begin the implementation of an expansion in a controlled manner. This decision is going to allow for the movement of ICU patients in a measured fashion and where there's appropriate system supports to care for them. We've also, at the same time, needed to implement bypass processes to mitigate capacity challenges in some of the busier units. These types of decisions, both big and small, are happening across the system. To be able to respond to outbreaks or shift our resources to meeting testing and contacting tracing demands, the more and more we're being forced to contemplate some of these difficult decisions. We will continue to work and keep these disruptions and service slowdowns limited, but they will be needed periodically. None of our COVID surge plans guarantee the system will be able to cope with the large growth in cases and associated hospitalization. This is why our ability to meet demand is up to the public. As you know, contact tracing, testing, and that third leg of the stool, adherence to public health orders, is critical to be able to bend the curve and allow us not to overburden the healthcare system and to be able to care for both non-COVID and COVID patients at the same time. I'm going to turn it over to Dr. Shaw, who's going to speak from her perspective as both a critical care physician, but also to speak to some of the things we're asking for from the public. Susan?
Thank you, Scott. Today, I want to speak not as the Chief Medical Officer, but as a critical care physician. As part of my work, I continue to take shifts in the intensive care units in Saskatoon. And as part of this work, I also spend time in our emergency rooms and our wards. I can see what this virus is doing on our front lines. I see how tired staff are with having to manage the pressures that come with this virus, but they still come to work. I sit with the families of those who have been admitted to our intensive care units with COVID. They sit beside their loved ones, all of them suffering, some of them dying, and they may never be truly face-to-face with each other ever again because of the need to wear masks. They do so because it's the right thing to do. And that, to me, makes putting on a mask when you go to the grocery store seem not so hard. Last March, I wrote an editorial in the newspaper committing to the public that our health system would be there for you if you can be there for us, and that is still our commitment. But I worry now more than ever about our collective commitment to keeping our health system from being overwhelmed. I worry when I hear every week that our contact tracers are facing verbal abuse from some of the members of the public that they deal with. That to me is unacceptable, especially toward people who are working so hard to help fight this virus. They say that people are experiencing COVID fatigue, and this is why people are becoming more relaxed about following guidelines, measures, and restrictions. I'm tired too. Our physicians and staff are also tired, and yet we come to work to make sure the system is there for you when you need it, whether it's due to a heart attack, a stroke, a diagnosis of cancer, or COVID. And increasingly these days, we come to work to see more and more patients that are suffering with COVID. And increasingly these days, we are forced to limit families and visitors into our buildings to reduce risk of sickness and death. And in the days ahead, I and my colleagues will have to tell more families that their loved one isn't going to make it. Compared to that, I believe that what we're asking of the public isn't so hard. When people come to the hospital, they often beg us to do everything you can, and now we are begging in return. Do everything you can. Limit your bubble as small as possible. Wash your hands regularly. Comply with all the public health orders, and please put on a mask whenever you're in a public indoor space. Putting on a mask is not a political statement. It's a scientific one, and it's a statement of love. If you're not willing to do it when it's recommended, then I invite you to trade places or join me for those conversations with family members whose loved ones are so sick and are at risk or dying. I assure you that conversation is much more difficult than wearing a mask, so please put on a mask, follow the measures, and we need you to do your part to protect those who are most vulnerable and to ensure a system is always there for you when you need it. Thank you.
Thank you, Dr. Shaw. Thank you, Mr. Livingstone. We'll now take questions from the room. Arthur?
It seems like we're following the path of provinces like Manitoba, and some of our neighbors have already tried some of the restrictions that we're putting in place today. Some of them have tried stricter policies. I think about BC, for instance. Yet it hasn't worked. They continue to see high cases. They continue to see exponential growth in some cases. Why are we following the same path that's already been, demonstrated to not be effective in those provinces? Why take half measures instead of the circuit breaker that some experts have been calling for?
I'll start and then I'll turn it over to Dr. Shahab. I think what we are doing right now is very measured responses, and I think the key to any success on this is going to be compliance. If we put in regulation after regulation after regulation, and there's no compliance on it, then the onus is back on the individual to be able to make sure that that they are adhering to that. When you go into a restaurant, that you are able to put on your mask, that you are washing your hands more frequently. The individual responsibility on this is the greatest responsibility out there right now, for them to be able to make sure that they're doing their part on making sure that their neighbors, their family members, their elders are safe. Dr. Shahab?
Yeah, thanks, Arthur. I think that's a really important point. And like I stated, throughout the summer, we were monitoring the reopen guidelines, but we didn't have to adjust much because our cases were low, apart from the sporadic outbreaks. Then for schools reopening, there was the 4 levels for school reopening. And, we have been in level 2 for most of the schools, and now high schools can go to level 3. So again, existing guidelines, you have to decide when to move to another more restrictive level or safer level as required. So that's already happening. And then when we look at our case numbers and the increase, we're obviously looking at where is the transmission happening. So it's happening in all settings, and it's not really always someone's fault, because we're not having those super spreader events due to people not following the guidelines at all. But we are seeing transmission happening, and part of it is that we all have to redouble our efforts to maintain those measures on everyday basis. But we also knew that if we go do some of the things that are important to us, like playing a sport, going to church, we will occasionally see transmission, even though we're following the guidelines. You touch a surface, you touch your eyes or mouth, inadvertently transmission happens. You lean in to talk to someone, even though you're wearing a mask, but you're closer than 2 meters, or transmission may happen. Rarely, masks protect, but not 100%. So we knew that, but the question is that when do you start restricting some of those things? And so we've already started restricting our gatherings in the home, because 10 people, including your household, because I've said many times, in my living room where I could have 12 people, I can't have more than 4 people 2 meters apart. It's just not possible. So we've already done that. There's some cost to ourselves, but then we need to remain connected, socially, but physically distant, connect virtually, the same things we were doing in March, and understand that some of us may need more support, either in person or remotely, because we want to also combat loneliness. Sports are excellent for physical activity to reduce stress for young people, older people. But again, we need to look at how do we play sports, reduce the number of teams we play with, reduce the number of sports we or our children are participating in. Maybe pick 1 sport, not 3. All those things have an incremental benefit. But absolutely, if we don't see the incremental benefit, but all of those things, then we will have to further restrict or make it not possible to do many of these things that we enjoy. So it is a graded response. It's a proportionate response, we think. But unfortunately, if we see cases that some other jurisdictions have seen in North America, Canada, and Europe, then unfortunately sometimes the only option is a significant slowdown or lockdown. But I think what we've learned over the last 9 months is that, and the modeling shows that, that if we all do these simple things, it can have a tremendous impact. So I think we do need to give this a good, solid try before we move into more restrictive measures.
Follow-up, Arthur?
This is for Dr. Shahab and for Scott Livingstone. You talked about where we're going in terms of modeling, and Scott talked about the likelihood of an uptick in hospitalizations and ICU admissions. Can you give us specific numbers for what you're expecting to see at the end of the current modeling period? I do understand you're doing like 14-day modeling right now. Can you talk about where you anticipate us being at the end of that? Because I expect that that's what's guiding your decision-making here today, and I think people have a right to understand on what basis you're making these decisions.
So I'll make some initial comments, and then I'll hand over to Mr. Livingstone. So my initial comments is that, ever since March, there was the long-range forecasting. And as you know, the Public Health Agency of Canada also has those long-range forecasts that, okay, if you do nothing, where will you get? And those are very high numbers for hospitalization and deaths. And of course, this look incredulous, but we have to remember, when we have had intense outbreaks in small communities, those outbreaks have followed the modeling projections or exceeded them. And let me be clear, our small, intense outbreaks in small communities have exceeded the modeling projections. If you transpose those numbers to the province, they meet or exceed the worst-case projections for modeling. So we should not underestimate that COVID can behave as ruthlessly in big, wide Saskatchewan as it has behaved in the spring in some places in Europe and the US, and as it is behaving again in some places in Europe, the US, and Canada. So that's number one point. But having said that, the long-range projections tell you that, okay, if you do nothing, the health system will not be able to manage. And people will not get a bed, like Dr. Shaw mentioned, for a heart attack. But then you have to look at all the three buckets. What should you plan for as an acute care system, long-range and short-range? But then what is the role of testing and contact tracing? And again, we have a robust testing platform, we have contact tracing in place, but then the third bucket is these two areas, the offensive strategy, testing and contact tracing, the defensive strategy, acute care and ICU, also dependent on public health measures. So public health measures which are severe, like lockdown, flattens the curve, but it's not sustainable. We kept it that for 4 weeks, 6 weeks, when we had to reopen in a structured way. Most jurisdictions want to avoid lockdowns because it has economic, social, impacts. But you want to do targeted slowdowns or adjustments to reopening guidelines, which we are doing right now. But all three buckets have to be aligned and in balance, because we can't let the health system be overrun. As Dr. Shaw very empathetically said, we need to make sure we cooperate with contact tracers. We should have minimum number of contacts on a week-by-week basis. We should have a list ready. Like I said, I make my list every Saturday, and I also realize if they're getting high, that what I should trim. But I have a list ready to go that if I am COVID positive, I can give my list to the contact tracers right away. And then we also we should go for testing responsibly. Go when you're symptomatic, or when directed by public health. And then the third bucket is public health measures that all of us do. So it's a balance among all three. It's not just one thing is enough, just hospital planning is enough, the other two are important, but it's a balance. So with that, I'll maybe ask Mr. Livingstone to comment further.
Thanks, Dr. Shahab. And the only thing I would add, Arthur, is we know enough from what we've already seen with respect to the response to the pandemic, what's going on in the provinces next door to us, as well as this ongoing relationship we have with the lagging measures. So as Dr. Shahab and Minister pointed out today, and I highlighted, what we're seeing today are cases from 2 weeks ago. And we know this last week we've had a running, I think, daily total of around an average of 125 cases, which was much more than what our daily average was a couple of weeks ago. We know that from the couple of weeks ago, we've seen 50 hospitalizations and a lot of ICU patients in the facilities now. And that's just naturally going to happen now because of the case numbers we've already seen. So as important as it is for us to tighten our belts and reinforce the public health orders and abide by them, we've already set in motion, at least over the next couple of weeks, we know we're going to start seeing increased pressure, and that's why we're activating our teams so that we can respond to that, both offensive strategy and defensive strategy. We're not stopping services. We're maintaining that dual response, but we know we're going to have to deploy resources to properly care for the cases that are going to come to us. And unfortunately, some of the things we've also seen in other jurisdictions, and again, it's highly dependent, as Dr. Shahab when you see an uptick in hospitalizations about two weeks down the road, you all see an uptick in mortality and deaths. And that's, we're going to do our very best to take care of the people of this province throughout the pandemic, but that is something we know, and need a forecast to do that. That's just the reality of what we know about the virus today.
We'll go to our next question from the room. Steph Davis.
So these restrictions come into play on Monday. You said that's to give people, enough time to adjust. Why is that necessary when it's essentially, more people wearing a mask or not serving drinks past a certain hour?
Well, as I pointed out in my opening statement, is if the obligation should be to do it now. It's coming into force on Monday because restaurants have to gear up their staffing or gear that down to according to what their new hours are going to be, as well as gym classes. They may have scheduled people out. We're trying to be considerate of the businesses out there to be giving them some opportunity to adapt to what are changing, as well as the hookah and waterpipe lounges. We want to give them some time to adjust to this new public health measure. In saying that, we also want to make sure that it's done as quickly as possible. So we're allowing them the weekend to be able to gear up their staff and make sure that they can notify their staff. And again, we're trying to work with our industries to make sure that this is feasible on their part.
Follow-up, Steph?
Yeah. I guess every other province in Western Canada has suspended indoor sports at this time. I know you did mention it's been considered, but I guess just why hasn't that been done yet?
Yeah, so this is an area that we are looking at very closely this week, and we may come up with some recommendations next week. But again, I think we'll be looking at the guidelines and the recommendations. But again, this is a message to all parents and children and adults who participate in sports. Think of what you're doing. Can you slow things down? Are you operating with as per the mini league guidelines? If you're playing 3 sports, you should probably play 1. And what I've seen repeatedly is that even in contact sports, there's a risk of transmission, but it's fairly low as long as you're not playing while you're unwell. But a lot of the transmission happens before or after the game in those socializations, especially for adults. Sports are a great way to stay active, but they're also a great way to socialize with your friends who you play with. And it's at the socialization where sometimes transmission happens, which is again what we've seen in workplaces, that the workplace itself may be safe in terms of your on an assembly line in a manufacturing plant or in your office, but it's the socialization during breaks, for example, where transmission happens. So that's where we need to pay attention. So it's not just about playing a sport or a workplace, it's also thinking very objectively about what you do when you get there. If you're waiting for your turn to play, do you keep that distance? Do you keep your mask on? As you're playing, actually, in most sports, you can wear a mask, and it looks odd, but you can safely wear a mask. It doesn't impact your aerobic activity or capacity. So I think we need to think very consciously about how can we participate as safely as possible in the minimum number of sports for ourselves and our children for the next little while. But obviously, if we continue to see transmission events, we may have to make some further recommendations.
We'll take our next question from the room. Ryan?
Early in this pandemic, we heard a lot about how many ventilators do we have, how much hospital capacity we have. We set up 2 field hospitals, which are still in warm idle, I guess. How close are we to triggering those to start activating them? And do we have the vents and do we have the people necessary to operate them?
Well, I'll probably get Scott Livingstone to comment on the operational side of things, but we're continually balancing, as Scott outlined earlier in his comments, we're continually balancing the ongoing needs of the province's medical needs to what the new needs are COVID, and that balance is continually being adapted on a daily basis, but we're also obviously looking out in the next 2 to 3 weeks to see what's going to be happening on that side of things. But we want to make sure that we're continuing. We've obviously brought our surgeries back up. We've been increasing that over the summertime. And now we've had an influx of COVID patients in the hospital and in the ICU, so we're continually adapting that. But I'll get Scott to touch base on the actual operation of the field hospitals and what that would entail.
Thanks, Minister. So just to go back to the question around where we are. So as the Minister has pointed out, we are not in the same situation we were in March, where we did a system-wide shutdown to immediately build capacity, both on the offensive and defensive side of the COVID strategy. So now with the dual responsibility that we have to both have the COVID response as well as take care of all non-COVID patients, that certainly is where the pressure comes from. But it also gives us, as I said before, the opportunities to intervene and change services so that we can redirect your resources in tornado response. So with respect to the number of ventilators, with respect to the PPE available to the province, we've been working over 6 months to ensure that that capacity is there. But the reality is, and same with the field hospitals, if we need to have the field hospitals, we will put them in place. But the reality is when that happens and if that happens is entirely dependent upon the number of cases that we see. Are we prepared to go from today to tomorrow? Yes, based on what we're seeing in case growth. But if we start seeing exponential case growth, that's where you're going to see major changes to the system. That's going to put not just COVID patients, but other patients at risk, because we will reduce other types of health services to support the work at both field hospitals, as well as other types of interventions that will be required to properly care for the people of this province. But with respect to, as I mentioned before, clinically, and Susan's probably much better to answer this than I would be, that we know a lot more about the disease clinically than we did at the start of this. We also are in a much better position as a province with respect to the tools that we need to be able to address the concerns. But it does not come without a cost, and I'm not talking about a financial price. I'm talking about what the cost would be to others if the system starts having to actually gear up so much more of its capacity to deal solely with COVID patients, because we just don't have that luxury. We are going to have traumas. We're going to have heart attacks. We're going to have strokes. And we can't minimize the impact that that type of service reduction would have on people across this province, because we've already experienced it. Susan, did you have anything to add about the clinical side?
I just agree with everything you said. We are prepared. We will be prepared. But I think our goal should be to never have to get to that point. And that's dependent not on the healthcare system, but on the actions of our public. And I know we've done it before, and I'm confident we can do it again. So it's just urging people to keep your bubbles as small as possible. The measures are the minimum. You can always go beyond and keep your numbers smaller and keep your contacts fewer, and keeping yourself safe, keep the people that you love safe, and keep the healthcare system safe.
Follow up, Brian?
Yeah, my wife's been a nurse for 24 years, and in all of her experience of that, rarely is there a day when the wards she's worked on aren't generally full. So how much capacity is there that we can play with here? We have 50-something in the hospitals right now. It doesn't seem like a lot for a system that has, over 1,200 beds? 1,800 beds? I don't even know what it is, but if that is maxing us out, where is that pressure point?
Maybe I'll just, again, a general comment. We are getting to that point where we are at what I would consider a tipping point within the healthcare system. That we need to make sure that we only have so many healthcare professionals out there, and we have to keep constantly adjusting them to moving them over from somebody that would normally be in the ICU unit to COVID. So we're continuously moving those people along that spectrum, and as more COVID patients come in, as Scott just outlined, we have to look at what services do we have to either reschedule or postpone to be able to take the complement of individuals from that area and put them in and treating COVID patients. So we're pulling from one side of the system to help the other side of the system. And that's going to be continuously adjusting. But the best way of making sure that we don't have to pull those surgeries is to be, again, compliant with the public health orders. Then the pressure comes off or lessens for the healthcare system. But that is not in my hands. It's not in Dr. Shahab's hands. Those are into the individuals' hands that are out there in the community. And if the media can push that out there, that we have to re-adhere, get back to where we were months ago in being vigilant with what we are doing and how we are doing this, because what we feared what could happen is starting to happen, and we have a very unique opportunity right now to be able to flatten that curve again or bend it as much as we possibly can. Otherwise, we are going to have some challenges, and we will be pulling more from one side of the healthcare system to the other side. I don't know if Dr. Shahab or Scott has anything to add to that.
Mr. Livingstone, I think.
Yep. So I would just like to add to the minister's comments by saying, we know how we can very quickly build capacity in the healthcare system over and above all the other things we've talked about is in preparing it with its tools. And that is by system-wide shutdowns. We don't believe we want to go there. We, as soon as Susan has talked about, as ministers has talked about, there is a way to avoid us going there, and that's actually through the support of public health orders and abiding by it. But, you know, on March 23rd, when we did a system-wide shutdown of the healthcare system, we grew capacity in 1 week virtually immediately across the system. We also, as a single authority, have eyes on acute care beds across the province. We've done training across the province for expertise. So it's not just based in Saskatoon and Regina. We have the ability to use beds outside of Saskatoon and Regina in many of our facilities to support COVID patients. You know, again, that comes with a cost, because the more patients we have that are treating for COVID, the less opportunity we have to care for patients that are non-COVID. We know with the elective surgeries, the elective procedures, we don't want to go down the path we did in March because of the collateral damage it causes in the delay in diagnosis. But we do always have that capacity. But as you've heard multiple times today, it's how do we avoid getting there? And we know what works. We've done it before. It's how do we double down and make sure that we don't put the system in a position that we have to make those hard choices on large scale.
We'll take our next question from the room. Steph?
It seems to me, Minister, you had an opportunity here to really flatten the curve, to send a strong message through new restrictions to businesses, activities, their consumers, about the gravity of the situation we're in. But some could argue you didn't do that, and you stuck with the bare minimum. So why choose to go with the bare minimum in this situation?
I feel that the responses we have are very measured right now. We have said right from the beginning of this that we were going to be surgical in our approach as to where we were going to look at minimizing or reducing the amount of contact that people were going to be having with each other. We have done that. We've been very specific in what we are doing here today to be able to make sure that we are flattening the curve. Again, the responsibility is on all of us, not just myself or Dr. Shahab and his team or Dr. Susan Shaw. The responsibility is on each individual to adhere to the public health regulations that are out there. That is what's going to help if we have a lot of regulations out there and there's no compliance, then it creates a challenge. So I want to make sure that the emphasis is on all of us to be able to adhere to this. This will help flatten the curve more than anything.
Follow up, Steph?
Aren't we past the stage of just asking people to follow the rules? Like, if you think the most important thing is compliance, how come your government isn't doing anything to encourage compliance? There's nothing in here today about increasing fines and new education campaigns, so why not do anything to encourage more compliance?
Well, I think that there are things in here. We're asking people that are in towns larger than 5,000 to be able to go to masking when they are indoors. That is something that we're asking them to comply with. So we have increased the compliance on that.
How are you going to ensure that is going to be complied with, though?
Well, I would say that I have full faith in the people in Saskatchewan to be able to comply to this. We are trying to get back, as I mentioned in my opening comments, back to the basics, back to where we were a few months ago when people were going out in singles to be able to go grocery shopping, where people were doing that. We need to make sure that people are adhering to that. And that's just not the general public in masking. That's also in the businesses to make sure. I've personally noticed that in some stores, people where the arrows are for people to go up and down aisles so they're not bumping into each other doesn't seem to be being adhered to as much as it was certainly back when the grocery stores started reopening. People were very diligent about that, and it's become a little bit more of a suggestion versus a guideline, and I want to make sure that people understand that this is extremely important. It only takes, as Dr. Shahab said, the community contact is out there. This isn't from super spreader events anymore. This is the average person in the average situation that is having multiple contacts.
So with respect, clearly asking people hasn't been working, hence why we're here today. So why not do anything more than just continually to ask people?
We may.
We'll take our next question. Adam?
I'd like, from a public health perspective, and the minister as well can answer this, we're saying, your bubble has to be small, you can only have so many people in your house, yet I can go to the casino with potentially 100 other people, or church, or to a concert, to a bar, and mix with other people. So how does that marry? How does that make sense from public messaging? Because people may be expanding their bubbles. The minister just said we're bumping into people or seeing that kind of thing. So try and explain that to the public and who are saying, I want to see more people, but they're able to go out into public places and do that.
Yeah. So I think that's a really important point, and I think this also links to the earlier question as well. So I think first thing, of course, is that if we all sat at home, transmission would be very low, but that's not practical. People have to go and work in healthcare. Children must go to school. There are many essential workplaces that have continued since March. And then there's lots of other discretionary activities that have started over the summer, going to see a movie, going to a restaurant, bar. And while I say discretionary, it does impact people in terms of their livelihoods and businesses. So, it's not just discretionary. It may be discretionary from a social point of view, but it is people's livelihoods. And there's a social and mental health component to that. Now, our guidelines ever since March have been good in the sense that if you actually follow the guidelines to a dot, transmission is very uncommon. But they have to be followed. And what we've seen is we started looking at all our reopened Saskatchewan guidelines with a magnifying lens. And what we've seen is that in many cases, and super spreader events that are not complying with regulations obviously deserve a fine because, people way out of line. But in many cases, what's happened is that when you're having group activities, spin bikes have just come closer together over time. People are doing aerobics indoors and just closer together. There's just been a slippage of that. So in the first instance, we need to go back to those guidelines, 3 meters apart. If you're doing, aerobics or a group activity, 3 meters is a big distance, almost as far as we are. So again, when you visualize what the guidelines are and you enact them, actually they do prevent, to a large extent, transmission and super spreader events. They won't prevent all transmission, but they'll decrease. So that's the second comment. But absolutely, I think if those are not enough, and our case numbers do keep going, then we will have to look at specific sectors, and then it is unfair to those specific sectors where there may be a slowdown or stoppage for a period of time, the circuit breaker for 2 to 4 weeks. The ideal thing is we don't have to go there, but it all depends on how collectively, conscientiously follow the guidelines. And regarding bubbles, again, that's a really important point. So, if you are in a household of 6, you can't have more than 4 people more in your house. But, like Dr. Shaw mentioned, these measures are the maximum. I would recommend if we have, a household, a larger household, we don't socialize with anyone outside. If we live on our own, it's not practical to say don't meet anyone for weeks, but select your 2 or 3 consistent friends and socialize in your bubble of 2 to 3 consistent friends and just keep it with that. So I think we have to find ways in which we can have some ability to socialize safely. Again, ordering takeout is fine, but going to a restaurant may be safer in some circumstances. If you don't have space in your room, if you're want to have a meal with your, close, consistent friends. So I think we all have to look at our own circumstances, make adjustments. And there are instances where, many bars and restaurants, people sit at the table, but then you're not supposed to mingle, but people are mingling, and that's where transmission is happening. So that is no longer allowed, and there may be inspections and fines if that is happening, not just, I would say, to businesses, but customers who are not following the guidelines.
Paul, Adam?
Yeah, there's a big spotlight on both of you today. I think there's a lot of pressure, obviously, on what's going to be announced today. It's people across Canada are watching, obviously, all the provinces. Doctors, Sun, some other groups, health organizations have written a letter. They've asked for mandatory masks province-wide. You haven't done that today. The mandatory mask, what you're putting in today doesn't cover the entire province, about 60, 70%. And they've asked for bars and nightclubs to be closed. You've done a curfew and an early last call. I'd anticipate they won't be pleased with that. What's your message to doctors, nurses, and the other members of those groups that are urging you to do more than you did today?
So I can make some comments, Minister, if you want. So I think the feedback and recommendations are very important, and I think I personally value feedback and comments from my colleagues in the province and nationally as well. What I would like to say is that, I've been clear since summer that wear a mask in indoor places. The mandatory guidelines is more for the trading areas where, one business had a sign, mask required, the other didn't. It's mostly to address that. But I said that, if you live in a small community, COVID is not going to not impact you because you live in a small community. Wear a mask if you're have to meet with someone in an indoor place who are not part of your household. That applies to all settings in Saskatchewan. It applies to gas stations on an intersection that are not in any community. Wear a mask when you're going in for the 5 to 10 meters to pay for gas, buy some groceries, or use the washroom. My recommendation applies province-wide. But then we also have to weigh the fact that, if you do want to have a meal, you can go in a safer way to a restaurant, static, sitting at a table of 6, versus ordering takeout and the same 6 people hanging out closer than at a table in a restaurant in your basement. So I think we need to balance what we can do safely versus what is unsafe. But I agree. I think we need to look at all our activities. We need to trim the ones that we really can trim as much as we can. But we will have to monitor. And unfortunately, if case numbers continue to rise, then we start entering into further stricter measure area or territory.
Minister, if you could just, what's your
Sure.
message to this?
First of all, I agree with Dr. Shahab. I want to thank the doctors for what they've been doing on the front line, and all the frontline care workers. I mean, they're doing a tremendous amount of work, and I think I could certainly hear it through Dr. Susan Shaw's voice on what the stresses that they are feeling. And they're concerned, and frankly, so am I. And I think we all should be. I think this is very serious, and for hundreds of doctors to write a letter to be able to express their concerns and voice it, I think it's very important that they did that. Dr. Shahab and his team have been amazing in guiding us through this, and with input from other doctors across the province, and also watching what other chief medical officers are doing across other provinces, and in Dr. Teresa Tam as well. What they're doing is absolutely amazing to be able to keep us safe. That's their job. And I think our job is to be able to work with them, adhere to the public health guidelines, and help them do their job. But when Dr. Susan Shaw, and I may not have quoted this perfectly, but I made sure I wrote it down, is the hospitals, what she had said was be there for you. They've always been there for you. And now they need us to be there for them and help them out. And I think that that's a very powerful statement, that we need to be able to help out our healthcare system, because they are always there when we have an emergency. And when we need help, the doors are always open, and they're making sure that we're safe. So we need to help them get through this.
We'll go to our last question on the phone line.
We have Roberta Bell with Global.
Hi, my question is about the recommendation regarding schools. A part of the press release that came out said that we've seen significant transmission in schools, but then we just heard, and again it says under that in the press release, that school setting is not where transmission is occurring. So can we just get some clarity around what's going on in the schools and why they're only being recommended to move to level 3?
Yeah, so first of all, I'll continue with Dr. Susan Shaw's recognition of healthcare workers, school staff, teachers, students and their parents, and frontline workers who have been working throughout the pandemic. So that's my first comment. Second, as schools reopen, they all open in level 2, which is mask use in common areas, and in many cases in classrooms. So all those layers of protection have kept school transmission low. We always knew that cases in schools will reflect cases in communities, and we've seen increasing number of schools with a single case acquired in the community, which has been handled in a way that there's been no further transmission. In some cases, there's been limited transmission in schools, very small numbers, not large outbreaks. And again, it speaks to all the layers that schools practice, including where appropriate mask use within classrooms as well. And what I've heard is that children have adapted to wearing masks throughout the school day very well. So I think if we want to learn how to wear masks, maybe we should look to our children for inspiration. But then, having said that, we also know that, and this is from the science that's emerged, that while children can obviously get COVID just like everyone else, they may be less able to transmit that efficiently, but we still need all the layers of protection in our classrooms. But older children in high schools, for example, may obviously need to stay home if they're sick, but if they're infectious in the 2 days before you develop symptoms and are in school, all the layers are important, including mask use. But some of the larger high schools, and this was already always in the plan announced in September, some of the larger high schools, more than 600, they need to look at going to level 3 because that further thins out the density in schools because, while children are in a cohort in the classroom, they still need to keep that physical distance in corridors if they're taking a bus. But level 3 will further thin out the situations, both not just in classrooms, but in hallways, on school transportation or other transportation. So that will be an additional layer that we've not seen large outbreaks in larger high schools, but we want to do everything we can to minimize that. And this also applies to us at work. Like, we have been very successful in continuing to work, but, where you can work from home, in sectors or industries where you can safely and effectively work from home, we should continue to, or again, start working from home. And all this thins out the number of contacts we have on a day-by-day basis.
Follow-up, Roberta?
In follow-up to, I think it was Adam's question, a significant number of frontline workers have expressed that they don't feel like they're being listened to by the province. What is your response to that? Do you feel like you're adequately consulting with them and taking in what they're saying as they put that out there through the media and other channels?
I'll comment on that one first. They are being listened to, and they always have been. I'm taking any of the suggestions or recommendations that they have very seriously. I would encourage them to work through their associations to be able to bring that to my attention or Dr. Shahab's attention. We want to continue working. The frontline workers are pivotal to the successes of when somebody enters the hospital. What my main thrust of this is, we want to make sure that there's less people coming to the hospital. To be able to do that, we have to make sure that we're adhering to the public health guidelines.
That concludes our time for today. Thanks for joining us, everyone.